I'm David Brigatti, a hip and knee replacement surgeon at Texas Healthcare's Fort Worth Bone and Joint Clinic. We are doing a patient testimonial video with our patient Theresa, who's about 4.5 months out from robotic-assisted total knee replacement. Robotic assistance can have significant benefits over traditional techniques for certain patients. It allows us to objectively balance the knee in millimeters before any bone has been cut and improves our precise positioning of the implants, thus allowing execution of this surgery in a way that until now was simply not possible.
Well, I was a surgical nurse for a long time, and I did a lot of ortho stuff and knees and hips. And I'd never seen the robotic done in the past. We always just did the old-fashioned knee replacements, where they had to go in and cut, test it, trial it, test it, open it back up, cut it again, you know.
Traditional knee replacement is essentially an educated guess and check technique where a hole is drilled in the end of the thigh bone and a rod placed inside the femur to pin a basic cutting block to the end of the bone. We then cut off an estimated amount of bone. Next, we manually align a rod to the shin bone using our eyes and carpentry skills. We use a basic jig to estimate how much bone to cut off the top of the shin. We then place a simple spacer block and subjectively assess if the knee is appropriately wiggly or stable. We then finish the rest of the bone cuts through basic guides and place practice parts. We move the knee around, hoping to have estimated the correct amount of bone to remove. For many patients, this guess is quite accurate. If not, we start adjusting the ligaments or recut the bone.
Dr. Robotic explained this procedure to me with the Mako. He took his time, explained every step of the process, and I'm so thankful that I did the Mako robotic replacement because I pretty much have full movement of what I did beforehand.
If you had to do this again, would you still do robotic assisted replacement?
Absolutely.
How was getting the CT scan of your knee done? Usually you have to get a CT scan to plan the surgery.
Oh, it was real quick. It only took like 5 minutes, 10 minutes.
Robotic-assisted surgical planning begins before the day of surgery with a CT scan or 3D X-ray of your leg, taking into account your individual hip, ankle, and knee anatomy. We then use this to create a 3D detailed model of your bony anatomy and design a preliminary digital plan of your knee replacement surgery. During the surgery, we must first map your digital 3D knee model to your actual body by physically touching points on your bones with a probe to show the robot where your bones are in real life. Next, we show the robot how stiff or loose your ligaments are throughout the arc of motion of your knee. We then reposition the implants digitally to balance the knee objectively in millimeters. Once the plan is finalized, we use a very sophisticated robotic saw to make what I call kindergarten cuts, meaning the robot will only allow you to cut inside the lines. If you try to cut outside the planned amount of bone, either the saw turns off or the robot prevents you from being off plan by more than 0.5 millimeter. By the time we put implants in place, the knee is objectively balanced and the implants are precisely positioned according to our plan.
I stayed overnight, went home the next morning.
And then, how long were you in physical therapy after surgery?
Do you really want to know?
I do, you can say.
2 days.
I think you were the only patient I've ever had that came back at 2 weeks and had said I missed therapy and you had all the motion you ever needed. That was very surprising.
Yeah.
With your permission, I'll show them the video of you sitting Indian style at 2 weeks. I was like, oh, that's impressive. So I believe you were on pain medications before the surgery, but how long were you on pain medications as part of the surgery?
As part of the surgery, just probably, I don't know, a month, month and a half, yeah.
And then, how long until you could kind of walk comfortably?
Week and a half out.
How long until you could sleep comfortably?
Couple weeks. Yeah, a couple weeks.
And then, how long until you could drive again?
I actually drove my second week.
All right.
So, I know that I was told not to, but anyway.
Do you feel better than you did before the surgery?
Absolutely, yes.
And then, how did surgery kind of benefit your life? Anything you've noticed that's easier or better for you?
Well, I do live up a steep set of stairs, and that was actually the hardest thing for me in the beginning, but now I can go up and down them like excellent doctor, answered all my questions. He was just an overall great man. I really appreciate how everything was explained to me from step one all the way to post-op, and even after that. And the hospital that I went to treated me very, very well. And all I can say is, if you need a knee replacement, get this Mako Robotic knee, because it's made a world of difference in me.
You were definitely my most striking patient after Mako knee. I've never had a patient like that after manual instrumentation knee before.
Right.